Testicular cancer is a type of cancer that originates in the testes, which are the male reproductive organs responsible for producing sperm and hormones, including testosterone. Testicular cancer is relatively rare compared to other types of cancer, but it is the most common cancer in young men between the ages of 15 and 35. With early detection and modern treatment, the prognosis for testicular cancer is generally very good. Types of testicular cancer. There are several types of testicular cancer, which are classified based on the type of cells involved. Germ cell tumors. These are the most common type of testicular cancer, accounting for about 95% of cases. Germ cell tumors are further divided into seminomas. These tumors tend to grow slowly and are more sensitive to radiation therapy. They are typically found in men between the ages of 25 and 45. Non-seminomas. These tumors grow more quickly and are more aggressive. They include several subtypes, such as embryonal carcinoma, teratoma, yolk sac tumor, and choriocarcinoma. Stromal tumors. These are rarer and arise from the supportive tissues of the testicle. They include Leydig cell tumors and Sertoli cell tumors. Risk factors. Several factors can increase the risk of developing testicular cancer. Age. Most cases occur in young men, typically between the ages of 15 and 35. Clitorchidism. Men who have a history of undescended testicles are at a higher risk. This condition can be corrected surgically, but the risk remains elevated. Family history. Having a family history of testicular cancer can increase the risk. Personal history. Men who have had testicular cancer in one testicle have a higher risk of developing cancer in the other testicle. Ethnicity. Testicular cancer is more common in Caucasian men compared to men of other ethnic backgrounds. Symptoms. Common symptoms of testicular cancer may include lump or swelling. The most common symptom is a painless lump or swelling in one of the testicles. The lump may be the size of a pea or larger. Pain or discomfort. Some men may experience pain or discomfort in the testicular scrotum, or a sensation of heaviness. Changes in size or shape. One testicle may become larger or feel different from the other. Fluid accumulation. Swelling in the scrotum may occur due to fluid buildup. Back pain. In advanced cases, back pain may develop due to the spread of cancer to nearby lymph nodes. Diagnosis. Diagnosing testicular cancer typically involves several steps. Medical history and physical examination. A healthcare provider will take a detailed medical history and perform a physical exam, checking for lumps or abnormalities in the testicles. Ultrasound. A scrotal ultrasound is often used to visualize the testicles and determine the nature of the lump. This imaging test helps differentiate between solid masses potentially cancerous and fluid-filled cysts. Blood tests. Blood tests may be conducted to measure tumor markers. Elevated levels of certain substances, such as alpha-fetoprotein AFP, human chorionic gonadotropin HCG, and lactate dehydrogenase LDH can indicate the presence of testicular cancer. Biopsy. In most cases, a biopsy is not performed due to the risk of spreading cancer cells. Instead, the definitive diagnosis is typically made after surgical removal of the affected testicle or cavity. Treatment. The treatment for testicular cancer depends on the type and stage of the cancer. Surgery. The primary treatment is the surgical removal of the affected testicle radical inguinal or cavity. This not only removes the tumor but also provides tissue for pathological examination to confirm the diagnosis. Surveillance. In early stage cases, especially seminomas, active surveillance may be an option. This involves regular monitoring with follow-up exams and blood tests to detect any recurrence. Radiation therapy. Radiation therapy is often used for seminomas after surgery to target any remaining cancer cells, particularly in the lymph nodes. Chemotherapy. Non-seminomatous tumors and some high-risk seminomas may require chemotherapy, especially if there is a risk of metastasis or if the cancer has spread beyond the testicle. Stem cell transplant. In cases of advanced testicular cancer that did not respond to standard treatments, High-dose chemotherapy followed by a stem cell transplant may be considered. Prognosis. The prognosis for testicular cancer is generally very good, particularly when detected early. The overall 5-year survival rate for men with testicular cancer is over 95%. Even for advanced cases, effective treatments can lead to successful outcomes. Follow-up care after treatment. Regular follow-up care is essential to monitor for recurrence and manage any long-term effects of treatment. Follow-up may include regular physical exams, blood tests to monitor tumor markers, imaging studies as needed. Prevention. While there are no guaranteed ways to prevent testicular cancer, being aware of risk factors and performing regular testicular self-exams can help with early detection. Men are encouraged to check for any unusual lumps or changes in their testicles and report any concerns to a healthcare provider. Conclusion. Testicular cancer is a highly treatable condition with a favorable prognosis, especially when detected early. Awareness of the symptoms and risk factors can lead to timely diagnosis and treatment. If you notice any unusual changes in your testicles or have concerns about your risk for testicular cancer, it is important to consult a healthcare professional for evaluation and guidance.